We often hear about the term obesity. How do we define obesity? What's a good definition for obesity?
So we define obesity by something called body mass index, which is BMI. You'll see that written everywhere. It is a calculation of height and weight, basically. And when a person is obese, it is a BMI of 30. That's considered mild obesity. When the BMI is 35, that's called moderate obesity. And severe obesity would be a BMI of 40, or called morbid obesity.
What makes up BMI? And so if a person doesn't know what that term means, how would they find out what their BMI is?
Okay, so one good way to go would be to go to mdcalc.com and be able to put in your height and weight, or even on the CDC or the even Medline, there's a calculator for calculating your body mass index.
We talked a little bit about obesity, but obesity in and of itself isn't the whole picture, is it, Dr. Ganguly?
No. So there are, as Dr. Havilana mentioned, there's a lot of medical conditions associated with obesity, and even a lot of things that we don't generally think of as associated with obesity. So the most common ones are diabetes or prediabetes, high blood pressure, high cholesterol, heart disease, strokes. Infertility is a big one. So we do see a lot of female patients in our clinics who suffer from infertility, and this can be linked to being overweight or obese, as well as simple things like reflux, which a lot of doctors treat, and that can certainly be associated with obesity. Certain cancers. So treating obesity is really, really important because it can help prevent a lot of these conditions. Osteoarthritis, which is something that comes with age, but certainly carrying excess weight can make that worse as well. Obstructive sleep apnea is another one. Fatty liver. So there's, the whole body can really be affected by obesity and overweight.
So it sounds like if you have these other conditions, it really is no choice about treating obesity.
Absolutely. Absolutely. So obesity is the root cause of a lot of these conditions. And so if we as healthcare providers are not addressing the obesity, we're just really putting a Band-Aid on those medical conditions.
We are a comprehensive clinic. Some of the most complicated operations that we have, we use to treat obesity, but we also have a range of things that we use to treat obesity. So Dr. Velasquez, why don't you talk a little bit about some of the complicated medical issues that we manage with our surgical treatments?
Absolutely. So we use different surgical techniques to treat obesity. And when we see patients with obesity, they have some of the conditions that Dr. Ganguly and Dr. Havilana mentioned, such as diabetes, sleep apnea, high blood pressure, fatty liver disease, cholesterol. And a lot of these conditions go away once they lose the weight with the weight loss surgery. For example, high blood pressure, 86 to 90% of the patients will have full resolution of that condition. Diabetes, 86% of patients will achieve resolution of diabetes. There are some fine prints that we have to look into. The length of the diabetes affection comes into play, how high the hemoglobin A1C was, and how many medicines they were taking. All of that influences if it's gonna go completely away. But even in bad scenarios, there's serious improvement. They come down on the number of medicines they're taking. They go for remission periods that could last 5 years without getting medications for those conditions. And Dr. Ganguly and I were talking about recently something called the legacy effect. That is that period in remission that patients obtain, the diabetes is not affecting a lot of their other organs. So it gives that overall health benefit when they lose the weight.